one day, 1,000 Virginians were exposed to measles by this one child. 1,454 cases in the U.S., 4 in Virginia. And I'm just going to give you about the most recent one in Virginia. School-age child, early September, 5 to 12 years old. Measles is really contagious, spreads through the air. You can contract measles when somebody has had it in a room even 2 hours after they've gone from the room. And you often don't show symptoms for days. When this child with measles was identified and the case was reported to public health officials, our Virginia Department of Health had to spring into action. They had to find potential exposure. The child, while infected but before demonstrating symptoms, had attended school for 1 day and had visited multiple healthcare facilities. In 1 day, 1,000 Virginians were exposed to measles by this one child. The VDH coordinated with the healthcare community and the school district to contract trace 1,000 people, followed up with 800 people, including babies in a NICU too young to be vaccinated, had repeated contacts with these individuals to make sure that they weren't showing symptoms. The VDH has dozens of staff, about 50 were working on this issue, and within days of the knowledge of the case, the VDH had worked to notify all 1,000 people. Now they have to continue to monitor for another 21 days. 45 to 50 officials had to work just on this one case. I'm very proud of their work. And I'm sharing the background just so people understand how serious even one case of measles is. The Infectious Disease Society of America says the median cost for a health department to respond to one case of measles is $32,000. So just multiply that by the 1,454 cases this year, $46,464,000 already to respond to measles, which is at a rate that we haven't seen in a number of years. A case costs a median of $3,200, but the price increases as you're trying to contact trace. The median price to contact trace is $223. So for Virginia, just to contact trace 1,000 people, $223,000 for one case. I bring this all up because to make it even harder for states to respond, in March, Secretary Kennedy rescinded $11.4 billion in public health funding to states. To Virginia, our Department of Health lost $425 million during the worst measles spread we've seen in recent years. The money was being used to modernize the state's technology to allow it to better track and respond to outbreaks, to upgrade the state's epidemiology labs, and to support community health workers. 100 employees and contractors in Virginia have been laid off because of these cuts. This shouldn't be happening.